Now look at this clinical application. What is this? This is actually the carotid sinus massaging. Oh, you are giving a gentle massage to carotid sinus. Yes, gentle massage to carotid sinus. Then what happens? Look, stimulation of carotid sinus triggers the baroreceptor reflex and increase vagal tone affecting SA and AV nodes. Okay, fine. If you are increasing the pressure inside the carotid sinus, you are increasing the pressure inside the carotid sinus by massaging, by giving a gentle massage to carotid sinus. Then what happens? Look, same thing, the pressure inside the carotid sinus increases and the stretch sensitive receptors, baroreceptors, are activated, and then it inhibits ultimately our rostral ventrolateral medulla RVLM, and then whole sympathetic outflow or thoracolumbar outflow is also inhibited and causing what? Reduced blood pressure. So carotid sinus massaging of carotid sinus reduce our blood pressure. Okay, fine. Now look at the ligation of carotid sinus. Okay, ligation of carotid sinus. So we are giving, or we are ligating the carotid sinus at different level. First, proximal ligation of the carotid sinus. So this is external carotid artery, this is internal carotid artery, and this is carotid sinus. And carotid sinus, this is arising from here, and we are giving a ligation to this portion. That means the proximal area of the carotid sinus. We are making a ligation, we are ligating the proximal area of the carotid sinus. And then what happens? Look, if ligation is given or carotid sinus is ligated at its proximal region, then proximal ligation causing no entry of blood inside this carotid sinus. Now no blood enters inside the carotid sinus, causing the reduced blood flow inside the carotid sinus. Yes, and also causing the reduced blood pressure inside the carotid sinus. Yes, so proximal ligation is given and it causes no entry of the blood inside the carotid sinus, and no entry of the blood inside the carotid sinus also cause less blood pressure inside the carotid sinus. Okay, less blood pressure inside the carotid sinus. Yes, and then what happens? Then blood pressure is reduced inside the carotid sinus. Yes, then baroreceptors are activated or inhibited. What is baroreceptor? Okay, that means baroreceptors are the body, some receptors which is located on the wall of the carotid sinus. They are what? Activated or inhibited? The baroreceptors inhibited. Okay, because why? Because the pressure inside the carotid sinus is reduced and baroreceptors are not activated. That means they are inhibited. Okay, if baroreceptors are not activated, then what happens? Blood pressure remains increased, because blood pressure increased. Because why? Because our rostroventrolateral medulla is tonically active. No one is inhibit him or her. Okay, and what happens in case of distal ligation of carotid sinus? Okay, look, carotid sinus is ligated at distal portion. Then the blood enters into the carotid sinus. But there is no exit point of blood. Blood cannot exit out from this carotid sinus. So blood accumulated inside the carotid sinus and blood pressure is also increased inside the carotid sinus, causing the distension of the carotid sinus wall, and baroreceptors located in the wall of the carotid sinus. Yes, baroreceptor located in the wall of the carotid sinus, they sense this pressure change or increased blood pressure, and then baroreceptor reflex is activated and they inhibit the rostroventrolateral medulla of medulla oblongata, and then blood pressure is reduced. Okay, fine. So that's all about, not all about, that's little bit about carotid sinus. Now look, carotid body. What is carotid body? Carotid body is generally located in between the external carotid artery and internal carotid artery. Where external carotid artery, internal carotid artery bifurcates, carotid body located here. What is this? This is nothing but a yellowish brown or brownish yellow colored structure. Okay, now function of it. Actually, the carotid body is a chemoreceptor, and this carotid body is related to our cardiopulmonary system. That means it is related to our cardiovascular system as well as our respiratory system, but it regulates our respiration predominantly and little bit regulation of cardiovascular system also. Okay, fine. So look here. Actually, carotid body it's stimulated by hypoxia, hypercapnia and acidosis, and also heat, insulin. They stimulate the activity of carotid body. Okay, so hypoxia, hypercapnia and acidosis, they stimulate the carotid body, and then the stimulation, when the carotid body is stimulated, it causes the firing of the carotid sinus nerve, and which activates the nucleus tractus solitarius of medulla. Okay, fine. And nucleus tractus solitarius of medulla. Okay, fine. Now